The World Health Organization chief arrived in the Democratic Republic of Congo amid the Ebola outbreak in the region. And he said that the spread of the virus, which has claimed over 200 lives, it can be stopped. The WHO chief landed in the capital, Kinshasa, on Thursday evening and will travel to Ituri province, which is the epidemic's epicenter, on Friday. The UN Health Agency's chief added that the WHO did not support travel bans to combat the outbreak because they don't help much. The WHO has recorded 10 confirmed and 223 suspected Ebola deaths in the DRC since the outbreak was declared on May 15th. And this is out of the more than 1,000 confirmed and suspected cases, according to its latest figures up to May 24th. Meanwhile, the WHO has also identified Ebola treatments and vaccines to be tested in trials. It has recommended prioritizing 3 experimental treatments for the Bundibugyo strain of Ebola. On the other hand, the Director General of Africa Centers for Disease Control and Prevention said that a vaccine against the Bundibugyo strain of the Ebola virus will be ready by the end of the year. Now, in terms of aid, the United States has allocated an additional $80 million to help combat the Ebola outbreak in DR Congo and Uganda. According to the State Department, with the new finding and the fundings which are promised, total U.S. aid will amount to $112 million since the outbreak began. The U.S. is also setting up a facility in Kenya to quarantine U.S. citizens who have been exposed to Ebola and will not bring them home if they develop symptoms, but instead send them to a third country, the White House said. The United States, Mexico and Canada have also announced aligned public health travel measures for individuals who are coming from African regions at greater risk from the Ebola virus. As per the joint statement, the coordinated approach aims to protect citizens and millions of visitors, fans, athletes and tourists who are expected during the FIFA World Cup 2026. Separately, the Democratic Republic of Congo's Health and Communications Ministries arrived in Bunia to oversee the response to the latest Ebola outbreak.
I am here, above all, to support the healthcare staff, who are bearing the brunt of the situation in healthcare centers because we have lost doctors and qualified healthcare staff. We are here, first and foremost, to show our sympathy.
Meanwhile, the head of WHO has also called for a ceasefire in Eastern Democratic Republic of Congo in order to contain an Ebola outbreak. He said the ongoing fighting was driving mass displacement and spreading the disease in overcrowded camps.